Hello, my name is Ayala Connell. I am the president and founder of Manual Therapy Seminars. Manual Therapy Seminars is a continuing education company that focuses specifically on the education of integrative manual therapy, or IMT as we lovingly refer to it. IMT is a gentle form of body work that focuses on looking for underlying reasons for why we feel pain and why we have mobility challenges and why we have overall health challenges. And it's been used over the past many years, several decades in fact, to treat all different types of people, children, adults, the elderly, and there are tools in IMT, diagnostic assessment tools, but also treatment tools to assess every part of the body, specific to the joints and the muscles, the bones, but also the nervous system, the circulatory system, all of our organs, the immune system. And then there's also a very special component of IMT to address more body-mind and the emotional body, the mental body, and our connection with a higher consciousness. It's a very comprehensive umbrella of techniques. And we've been using these techniques for a long time in a clinical fashion, and also we've been teaching these techniques for many years around the world. And over the years, we have seen so many different examples of wonderful benefits to the work. So I wanted to take a couple of minutes and talk about what IMT is and the history of IMT. Integrative Manual Therapy was originally founded and developed by Sharon Wieselfish-Gimateo. I should say already that Sharon was my mother, and she was a very special, brilliant woman. Unfortunately, she passed away a couple of years ago, but she accomplished so much in her short life, and we are all blessed for it. IMT has some very special diagnostic techniques that allow us as practitioners to put our hands on the body and understand and identify what's going on in an underlying level to someone's problems. So I'll use a very basic example. I think these types of examples are always helpful to have a sense of what it is that we do and what it is that we teach. So imagine someone that has a frozen shoulder. So in that sense, we know that the person's shoulder is painful, typically at rest and in movement. It's probably very weak, possibly even atrophied in the muscles. It's probably very hypomobile or limited in motion. And in typical conventional rehabilitation for frozen shoulder, there might be some gentle mobilizations that are done, some exercises to try to strengthen and stabilize the area, maybe some modalities like laser and ultrasound and things of that nature to try to get a little bit of healing in the joint. But one of the founding principles of integrative manual therapy is this understanding that the body goes into a state of protection when there is something vital that's compromised. So what would be at the hierarchy of protection in the body? Well, that would be the arterial system or the heart, our circulatory system, things of that nature. So let's say there's something going on underlying in this part of the body, maybe in the chest, maybe in the shoulder, maybe in the neck, the upper back region. Maybe there is spasm along the smooth muscle of one of the main arteries that goes through the shoulder. Maybe there is a breakdown of the bone on the joint surface, which we would call bone bruise. Maybe there is a nerve impingement in the brachioplexus nerves that go through the shoulder region. Maybe there's a lack of integrity, a weakness in the wall of the upper lung. Maybe there's something going on with the heart itself. Endless possibilities. But if that's the case, the body is going to want to limit mobility on purpose because it's not going to want to exacerbate or further compromise the issue by allowing us to be too mobile. So as a result, we develop postural deviations and movement limitations, and the pain that we feel is really because we can't move, because we're locked down. It's really the effect, certainly not the cause. So with a frozen shoulder, in our perspective in IMT, it is the ultimate in a protective mode. The shoulder is locked down. The body does not want to move in that area because something underlying is compromised. So with IMT, as an integrative manual therapist, I would put my hands on the body and I would feel for different rhythms in the body and different patterns of fascial tissue tension that would give me information to understand what are the systems in the area that are compromised Is it an arterial tissue? Is it a nerve that's impinged? Is it the bony surface of the joint that's compromised? Is it one of the organs in the area? It could be so many different possibilities. And of course, the more training that we have in integrative manual therapy, the more ability we have to be perceptive with our hands, to have greater sense of intention and intuition as well. But palpation, it comes down to palpation, being trained to feel things in the body that are very unique to IMT. And maybe we catalog a list of things that we're finding, a whole problem list of underlying dysfunction, tissues that are compromised. And then we pull out IMT techniques that are related to those tissues. There are so many IMT techniques today, thousands and thousands and thousands of tissue-specific, system-specific techniques. So maybe there's a nerve impingement of one of the brachial-plexus nerves. Well, I might pull out a neural tissue tension IMT technique. Maybe the axillary artery has some spasm, some protective muscle spasm in the smooth muscle that's lining it. Well, I might pull out an advanced strain counterstrain technique to treat the arterial tissue in that area. Maybe there are some bone bruises on the surface of the shoulder joint. So I might pull out the IMT bone bruise technique. And I will treat the underlying dysfunction. And my expectation is that I will be able to palpate an improvement in the tissues and the integrity of the tissues. But also my expectation is that the body will have less of a need for protection in that area. And as a result, either the protective mode will fall away on its own and the person's frozen shoulder syndrome will improve and the mobility will be restored and so on. Or at this point, I can actually work on the joint compression, but with more sustainable results. I might actually be effective now with some gentle mobilizations to open up the joint and reduce the pain that the person's feeling. All in all, it's always the same goal. We're looking for the person to have greater function and less pain and more mobility and ultimately being able to return to their quality of life. And IMT is such a wonderful tool because it's really looking for underlying structural dysfunction. Which leads me to another analogy and will help to explain where IMT fits in the world of rehab. And regardless what type of practitioner you are, it's really a large umbrella of techniques. So you pull out techniques that are relevant to the type of clients that you work with. And you might work with all kinds of clients like us, or maybe you're a speech therapist, or maybe you're a therapist that works just with people that have hearing impairment. There's so many possibilities. But if we talk about the difference now between structural and functional rehabilitation, or structural and functional therapies. You know, I'm a physical therapist by training and a manual therapist, of course, because I've had a lot of training in integrative manual therapy. But to talk a little bit about where all that fits, with someone that has a frozen shoulder in conventional, traditional physical therapy, let's say, as I said, you do some mobilizations, some exercises. You're really trying to take a drawer that's stuck and pull it open. Whereas with IMT, oftentimes we're really trying to gently push it in and then pull it out so we can really see what's underlying. Well, if you imagine a child that's sitting in front of a piano, and let's say the child doesn't know how to play the piano. So you get a wonderful piano teacher in there to teach the child how to play. And that piano teacher would be symbolic of a functional therapist, maybe a functional PT, maybe a personal trainer, someone that can teach that child how to function optimally with the body, which is in this case the piano. But what if there was something wrong with the piano itself? What if maybe one of the legs was wobbly? Maybe one of the strings in the piano was broken? Well, no matter how skilled that child was in playing the piano and playing beautiful music, there would be no potential for good music. The potential for function would be limited because there was something structurally wrong with the piano. Well, integrative manual therapy, or IMT, falls into a structural therapy category or structural rehabilitation category, where we are the people that come in and treat the piano, fix the wobbly leg, and fix the torn string, and create a greater potential for function. The person that comes in to fix the piano is an IMT therapist in this analogy. But once the piano is fixed, now there's this wonderful potential for music, but maybe the child forgot how to play. Maybe the child never knew how to play. Maybe it's a new child. So the relationship between structural and functional therapies is vital. It's absolutely important. And as a physical therapist, I'm trained in functional therapies as well. But many of our health practitioners that have taken classes over the years and study integrative manual therapy, maybe functional therapy is not their skill set. And that's when you start to network and collaborate with other therapists in your community because they're both so important. But integrative manual therapy is absolutely in the realm of structural therapy. And that gives you another example of where it fits. So thank you for listening. This was just a short little video to help explain what integrative manual therapy is. And I hope you tune in for some more videos on IMT.